An intravenous 4 infusion rate, usually expressed in cubic centimeters, cc, or milliliters, ml, per hour, is part of a physician's prescription for the fluid or medication to be administered. In U.S. hospitals, most 4 fluids are infused with a computerized 4 pump to ensure accuracy. 4 pumps, however, do not forcibly pump fluid into the bloodstream. Rather, they allow infusion of the medication at the prescribed intravenous infusion rate despite the relative height of the 4th bag, and sound an alarm to notify nursing staff if it is unable to instill that amount. Many factors can affect the prescribed or actual intravenous infusion rate, including the 4th cannula gauge, the location of the 4th cannula, the condition of the patient's veins, and the patient's physical condition. The 4th cannula gauge, or catheter diameter, can limit an intravenous infusion rate. Larger cannula gauge numbers, with smaller diameters, have smaller maximum infusion rates than do large bore cannulae. For this reason, large bore cannulae are routinely placed in trauma patients, surgical cases and transplant patients who regularly require large infusions of 4 fluids. For patients who require a large amount of 4 fluid very quickly, large cannulae can easily handle a liter or more of fluid infused in minutes with an inflated cuff around the 4th bag to force a fluid infusion beyond what gravity and an open line would instill. In the absence of an 4 pump, gravity can influence an 4 infusion rate as measured by the height of the 4th bag above the patient's heart. Another factor that can influence an intravenous infusion rate is the location of the 4th cannula. The more peripheral the 4th placement, the slower the maximum infusion rate as the veins are smaller further away from the heart. Thus, an 4 placed in the hand can handle less fluid volume than can one placed in the antecubital fossa, also known as the inner elbow. Peripheral IVs in the hands or arms also can cause intermittent infusion interruptions when patients use their arms and crimp the blood vessels or the 4th catheter is inadvertently placed against a vein valve. Central lines, such as those placed in the subclavian vein close to the front clavicles or collarbones, can safely accept a higher intravenous infusion rate than peripheral lines with fewer chances of interruption. A patient's diagnosis can also limit a prescribed intravenous infusion rate in order to avoid risky complications. Patients suffering from congestive heart failure, CHF, kidney disease or other conditions necessitating fluid limitations require slower 4 infusion rates. Finally, some 4 medications, such as chemotherapy solutions, can only be infused at certain rates for the body to safely tolerate them.